when you help others, you help yourself because, and I'll explain as we go along. So many of you know Dr. Zhang, and I was fortunate enough to be a patient of Dr. Zhang's for Lyme, and it catapulted me out of it. Wait, here's some other people, so sorry. So Dr. Zhang, again, we're blessed, is in Westchester and New York. And Dr. Zhang focuses on modern Chinese medicine, which he's going to talk about, but it's the integration of Western and Chinese medicine, making for a much more harmonious way, as we all know, of healing. Not bombarding the body, but giving the body what it needs, and a lot of it is with herbs. And we'll get into all of that. Dr. Zhang has taught worldwide. He had a fellowship at Harvard Medical School. He's done extensive research with AIDS and Lyme and autoimmune disorders and those lovely little viruses that we're all, up here's some more people, sorry guys, that we're all dealing with. And never did we really think that we would have to deal with such an insidious virus. And we're going to go into that with Dr. Zhang because he has a blog and you can read about it, but it's not just about COVID, it's about keeping your immunity high. And if you do get COVID, which I just learned from Dr. Zhang, there's a host of issues that can develop from it that they're finding out. So welcome, Dr. Zhang. And I know people have questions about Lyme and a lot of other things after, but for now, we're just going to go into the viral COVID land. And so, Dr. Zhang, what is your experience? You've dealt with viruses and Lyme and all these critters with COVID as set apart from, you know, the other areas that you've worked in.
You know that the COVID virus explode, that breakthrough and explosion is only about 6 months old. So it's quite new. Everybody is learning. I think this is a very new disease. And so we're learning from it to borrow the experience from SARS, from MERS, from the flu, H1N1. So from those things, we borrowed the experience and also the medication for that. And I myself, I'm a practitioner quite different from other people. I am not in the establishment. I not belong to the conventional medicine because I'm not using the pharmaceutical drugs. I not belong to the traditional Chinese medicine like acupuncture school. They also don't acknowledge me because I'm not talking yin and yang, 5 elements, or cold and hot, those kinds of terms. I using pathophysiological and phytopharmacological terms to explaining my the Chinese medicine's the philosophy. So this is my experience on the infectious disease since from AIDS. I've been on doing AIDS for many years. I published 2 books on AIDS and with treating with modern Chinese medicine. And because AIDS it's an immune deficiency disease, immune dysfunction. So because this, I learned about autoimmunity, immune deficiency, oversensitivity, extensive inflammation, those immune disorder. And the second virus disease I have been learning and are treating was hepatitis C. That is, it is discovered in 1992. And this also, at that time, is a brand new disease. So I studying it and I wrote books about it because writing book is my way of learning. And then after the hepatitis C, they find some anti-HCV treatment so that many people turn into the conventional medicine. Then I now are treating the Lyme disease, another infectious disease. And during this time, also because we're using the things for babesiosis, then that is the substance we discovered also good for cancer. So we're also doing cancer survivors treatment and
that's
preventive treatment.
with the Artemisia,
Yeah.
right?
Yes.
And we can talk about that if anyone's interested, because there is a program that you would stay on.
Yes.
After you are in remission.
So now we come with the COVID-19. And so this is also very new. We have to follow up it closely and also now have some information and also misinformation on the web. We have to analyze and to filter it, what information is correct, what information is incorrect. So we have to learn, and then I translating, I put into my blog. In this way is the way of my learning of that. So because this learning, I think now, when this break out in the January, in the last December, I was in China. So we met this situation. It's about 2 or 3 months earlier than here. And also China, they have a very well-organized the control of this epidemic. And also lots of information can be learned. And also they're using Chinese medicine plus Western medicine to treat this problem, this epidemic.
Guys,
So that is why I have some information about the rule of what the Chinese medicine can do in prevention and treatment of the COVID-19 pneumonia.
So, Dr. Zhang, so I know you guys, can you all mute your audios until we're ready to just ask questions? Because there's 2 different protocols you have. There are the new remedies that China is sharing with the world that we talked about, the clear lung detox, and I'm not even going to try to say the names because you will laugh at me, but it's the Wan Fei and the Wao She. But these are items that you will have that will either treat people preventatively or if they have an active infection. Can you explain that to us?
In China, I think that the Chinese State Council of the traditional Chinese medicine, they announced 3 patent medicine, herbal medicine, 3 herbal formulas as the specific treatment for COVID-19 infection. And among these 3 patent medicine, herbal medicine, one of it is called Lianhua Qingwen capsule. And the Lianhua Qingwen capsule is this. And this one is developed for SARS in 2003. And SARS is in the coronavirus family. And the COVID-19 is belong to this family. So they can have some of the cross effects. So this is what we've been using. I'm getting it by a special channel, and I also getting it by a very quick, very expensive express shipment. And I mainly use it for myself, for our family, and also for our old patients. And because to make Chinese medicine, to make people accept, it's not so easy. Only the patient I have before, they know me, and they have been get the benefit from Chinese medicine, then they will accept much easier than other people.
When Dr. Zhang, though, people know you and have come to you for everything from AIDS to Lyme to cancer. You've written many books successfully. So I would say you're accepted, but it's probably, are you still finding it challenging to get your protocols, you know?
I think that it's an overall mentality, you know. Most people, they just follow the doctor's advice. Even like in chronic Lyme disease, many people just follow the doctor's advice. They have been trained, also taught in this way. So to introduce exotic medicine is difficult. And even myself, like when I was a medical student in 1958, that was my third years of medical school. And the Chinese government starting a movement to modernize Chinese medicine, starting to teach us yin and yang 5 elements, and hot and cold, excess and deficiency, these concepts, including myself, all my classmates rejected. So only when we going into the internship, we find it works. So we pick it up again. Then I think it's we need to use in the clinical outcome to convincing people. Particularly conventional medicine and the Chinese medicine, the treatment methodology is quite different. Even like for the COVID-19, everybody now designing in conventional medicine is hit the virus, to stop the virus. But nobody studying how to support the body, to make the body stronger, to avoiding the virus invasion. After invasion, avoiding those complications, serious complications to happen. So those are we call the constitutional and overall the holistic way of treating, because disease happen in the body. And the virus everywhere, like the ticks everywhere. Many people get tick exposure, but not everybody develop Lyme disease. Not everybody develop the COVID-19 pneumonia. So why? It's because the body is different. So finally, determine the disease happen or not. How the body can respond into the treatment. What is the prognosis? What is the clinical outcome? Is determined by the body, not determined by the external invasion. The external invasion is the same, but the body is different. So the people's outcome is different.
So you're saying, well, let's start with this then. I know people want to know, just to start with basics. We feel okay, we don't have COVID, we don't want COVID. Would you start, and I know you're very big on the allicin, which is the garlic, and the circulation P. So before we go into the things to take for COVID, what is a good protocol to keep our immune systems buoyed up so we will not come down with Lyme or COVID or God knows what else?
About the allicin, I think that I asked the people to listen to Dr. Andrew Wells' podcasting. Dr. Andrew Wells has a podcasting, a talk about his thoughts about the tactics of preventing COVID-19. This podcasting is in the Kevin Rose Show, Kevin-Rose, the Kevin Rose Show. In this Kevin Rose Show, you can Google it, and there's a Dr. Andrew Wells talking about how to prevent the COVID-19, and he strongly recommended two things. One is this. This is called glycyrrhizin, which is a licorice root extract. And we used it before for HIV, for HCV. And then another one is the allicin. Okay, allicin is a very strong garlic. And most of the garlic, they are advocating odorless, chaotic, aged. They reduce odor. Reduce odor reduces its efficacy of anti-infection. And why garlic has these good effects? I can tell you a story. In China, there's a county called the Lanling County in Shandong province. This county is the main garlic and ginger producer of China. They produce most of the garlic of China. And this county has 1.46 million people population. And they have about 10,000 people working in Wuhan, that is the epicenter, Wuhan. And when they are selling garlic and ginger in that city, and they eat garlic daily. And these 1,000 people, 10,000 people, they go back to for Chinese New Year festival. No single one caught COVID-19. And the whole country is 1.46 million people. No single body got the COVID-19. And also, I learned this allicin. I learned from my son. My son, 6 months old, he developed very high fever. At that time, I was an orthopedist in the teaching hospital in Shanghai. And the pediatrician is my classmate. He used all possible antibiotics, but the fever doesn't retreat. Finally, he asked me, do you mind if I'm using garlic? I said, where it comes from, the garlic? Because he said the garlic is made from our pharmacist of our hospital. Our hospital made it. It's intravenous infusion.
Wow.
I asked him, I said, did you use it? He said, yes, I used it. It's very effective and it's no side effects at all. So I think because this, I talked with my wife, we agreed to use it. When I holding my 6 months old son and the drippings from here, within 1 hour, I saw that the face turned from red to normal and the temperature release within 1 hour. So because this, I remember it. Then when I started to treat the AIDS, AIDS, the HIV is not life-threatening. HIV doesn't kill. Killing mostly is caused by opportunistic infections. And I have a patient, Daniel, he come to see me. He said, I have a friend literally on deathbed, 0 T4 cells, Kaposi sarcoma, CMV retinitis, PCP pneumonia. So it's waiting for death, die. And he asked me, anything you can do. At that time, I have liquid injection garlic, the Allison. I gave him for 2 weeks supply, and he as a drink to do as drink. 2 weeks later, the patient, his name is Steven Jerzynski. Steven come to see me.
Oh my God.
And you provided him for 10 years. That this treatment cleared PCP pneumonia, didn't slow down the Kaposi sarcoma, slow down the CMV retinitis, and he be able to go back to as a massage therapist to do massage. And he died. He come to see me in 1993, died 2003. So it's 10 years. After 10 years, because his vision is too bad, so he said, I don't have the confidence to survive anymore. I like to die. He chose to die. So this means this is a very good, this story about Allison. I do any dental work, I never using antibiotics. I just using a capsule of the Allison put into the mouth and preventing any dental work caused infection.
Dr. Zhang, you always use the Allison with the circulation P, right? Are they always together, or am I wrong?
Circulation P is a very good general health support. In Chinese medicine, there's a theory. All the long-term sickness always have blood stagnancy. So to make the blood circulation smooth, is the first one to treat the chronic disease. And also another theory, pain caused by blockage of blood circulation. In order to release pain, we have to make the blood circulation smooth to bring more blood to the pain area, to repair the tissue, then the pain will be released. And also for the lung, it causes the hypoperfusion in the brain, hypoperfusion to the peripheral nerve, causes central nervous neuropathy, peripheral neuropathy. And also this formula can ungroove the immune complex. Immune complex plus complements cause inflammation. When the immune complex is ungrooved, removed, inflammation level goes down, symptom release. So it's a very general health support, especially in the COVID-19.
Right, so
COVID-19 has a very damaging problem. Yeah, COVID-19, before we call it as COVID-19 pneumonia, we thought that the chief organ is attack is lung. But now we find it's not true. The virus get into our body through a receptor. The receptor is called ACE2, the protein, ACE2, which is enzyme. This enzyme exists in the endothelial cells of the blood vessel, the linings of the blood vessel wall. And because the virus first combining with the ACE2, so it's caused the endothelial cell inflammation. That is, make the blood vessel, the inner linings very rough. Then this causes coagulation. This we call the diffused intravascular coagulation, DIC. The DIC is very dangerous, especially in those organs very rich in microcapillaries networking, like a lung. Air exchange, you need a lot of microcapillaries. So why the first attacking showing looks like a lung, but really is the blood vessel, like a kidney. kidney is filtrating the water and the wastes. So that area very rich in blood vessel. So kidney failure. And today I put an article in my blog. And the article is the sequel of COVID-19 infection, including lung thrombosis, and also including the kidney failure. It also, if the thrombosis goes to the brain, stroke, goes to the heart attack. So it's because this is affecting the blood vessel, so it's causes multiple organ involvement.
So people that are asymptomatic, that don't know they have COVID, are they also possibly open to this DIC exposure?
Yes, because they already affecting the inner linings of the blood vessel. So the circulation P formula has a very good effects for treating DIC. And
You're just taking another one now.
yeah, its indication, one of the indication of this is for treating DIC. You know, DIC is so important. Mount Sinai, they find this problem. For those people on the ventilators, the death rate before was 67%. After they using blood thinner, the death rate from 67% down to 23%.
Yeah,
So this is why the knowledge we know about how does the virus attacking our body. So they learn this, so they're using blood thinner. But the blood thinner is compared with this is not as good because blood thinner is only one-dimensional, always thinning.
Dr. Zhang,
This is to promoting the blood function. Blood is a liquid. In the blood vessel, we have to make it thin. But if you have a cut, the blood goes out of the blood vessel. We have to promoting coagulation. So coagulation is not a passive vaporization. Coagulation is active, the biochemical reaction. It's a blood function. So this is promoting blood function. With this, when the blood inside the blood vessel, it's make the blood thinner. Make the blood goes to every tissue easier.
So,
and when it's out of the blood vessel, it's promoting coagulation. So it's two-dimensional.
so the allicin and the circulation P is just a preventative, just for good health and for kind of warding off the virus and keeping the circulation active.
Yes, recently when I read about the COVID-19 invading the endothelial cells of blood vessel, I made a search. I find that allicin has a protection effect on the endothelial cells of the blood vessel.
Oh.
Yeah.
And then you told me if someone has active COVID, and so I think it's important to know that some people do not know they have it. So at the very least, you would want to be on this. It's one twice a day, right? It's one of each twice a day.
The allicin is we're using as a preventive use.
Right.
And especially one way of doing it is if you need to go to clubs, you need to go to shopping. Besides wear a mask, you can put one capsule of the allicin into the mouth. Don't swallow. Keep it there.
Well, no one will go near you then.
Yeah, keep in the mouth. In this way, in this area, the concentration, the local concentration is very high.
Wow.
In this way, the protection will be much stronger because the virus mainly going through mouth and the nose and eye. So if you put one capsule in the mouth and don't swallow, and in this area, the local concentration is higher than you swallow.
Dr. Zhang, okay, so to go back, it's one of these, one each twice a day, but what, does that need to be accompanied by the HH or not necessarily?
HH is Dr. Garland in New York City. He has an article, and he found that Houtonia calata, that is the herb, which can block the COVID-19 virus reproduction. So that is why he think if people get the infection, HH will be helpful.
Okay, so for prevention, it's just these two.
Yeah.
If you get the virus, then you up the dose of this and you add the HH. So it's allicin, circulation P, HH, and it's 3 times a day.
And also we do this, the
And the new one.
LH24. This one can treat mild, moderate cases, preventing them turn into serious and critical condition. And also it's also good for already serious and critical condition to make it protect the body better. This is for the, before was for SARS as very effective. So it has been used since 2003. And we using it also can use for like a flu or like the virus cold, the cold caused virus.
So you would take that LH24 if you were active with the allicin and the circulation P.
Yeah.
You
Then
add
the
HH.
the clear lung and the detox decoction we already received, but now we are just waiting for the bottling, because we just ordered not a big amount. So the bottling company, they have some difficulty. We have to ask them to special make arrangement to bottling for us. So that is, that
So
one, that one you can read my blog, and this has been designated as a special treatment for COVID-19 in China by the Chinese State Council and by the administration of traditional Chinese medicine of the whole country, China.
And it's been very effective. You've had really no fatalities.
Yeah.
Which is
and in China, if compare with solely using Western medicine, people use the integrative Chinese and Western medicine or using Chinese medicine alone, the death rate is about 87.7% less. So that this is, there's a county in China, it's a city called Baozhou City. It is traditional Chinese medicines because about 1,800 years ago, the first Chinese surgeon, Hua Tuo, he invented the general anesthesia. He did an open scalp surgery 1,800 years ago. And that is belong to this city. So they have a tradition of using Chinese medicine. And they have 108 people COVID-19 positive. And none of them die. Everybody recover, including one person is 89 years old.
Wow.
Yeah.
Wow. So you've obviously treated many of your patients successfully with the COVID.
Yeah, that I think that with the 24 with the clear lung and the detoxin decoction, I think we are quite well protected. We prepared.
But how does someone know if they're asymptomatic? Do you think that everybody should be tested? So if they should go on the LH24, or should they do that? Is it okay to just do that as an extra added precaution?
To be tested, the only benefit is to not to spreading out for other people. And really, test positive right now, only supportive treatment in the conventional medicine. There's no special treatment available. Besides ivermectin, but this is still not confirmed yet. So most of Western treatment is etiological treatment, aiming the virus.
Right, not
Chinese medicine treatment is to
body.
supporting the body. Yeah, so these are two different ways. And so I think that if I were you, if I don't have any symptom, I would not test it. If I have symptomatic, then I tested mainly is for protecting my family, not to catch it from me, from the other people.
So what's your ideal protocol for people that do not have any symptoms? Is it just the allicin and the circulation P, or is there something else? Because they say that everybody eventually is going to get one of these, like you said, the flu or the SARS, everything is heightening.
Yes, because now the pandemic plus the real, so it's the second peak is coming.
Right.
Yeah. So I think that to be well prepared is very important. And we have our office have you probably some people know her, Phyllis. She has a friend, family has 3 people tested positive. They're using allicin, and finally these people are okay.
Wow.
Didn't develop to a serious disease. So I think that so allicin is good, although allicin has not been tested.
Right.
Not been like in the double blind
But there's no downside.
Nobody going to do that because there's no benefit of financial benefit for doing this. So that I think, as my experience, I think this is, I believe it can help with to preventing it. And Alison, I have another story, you know. My father-in-law in Shanghai, he's a very famous ophthalmologist. When he's 90 years old, he developed a very severe pneumonia and got into the hospitalized in the teaching hospital I used to work. And they give my brother-in-law the notes saying, you have to get him the things ready twice. And the brother-in-law called us here. I told him, I said, I will call my classmate. At that time, my classmate, he's the president of the university, medical university. And the doctor responsible for my father-in-law is his student. I told my classmate, I said, go to tell your student, I will be responsible. I tell them how to use it, how to do it, using intravenous allicin dripping. After 2 days, my father-in-law was walking around in the wall. Those nurses were very surprised because they're expecting him to die. He's already 90 years old. So that is why I'm so much in face on the allicin. Yeah.
And this allicin it's time released, and unlike other allicin, it really does not upset my stomach. It's very easy to digest.
This is time release because the granules inside the capsule has different speed of the resolving in the stomach, and also it's enterically coated. It's not dissolved in the stomach, it is dissolved in the intestine.
Somebody would like to know, what is the ingredient in circulation P, or the ingredients that you feel are the most active for promoting the circulation?
This is a traditional formula. It's made from two of the very famous of formula. And this one, I will going to put it in to explain it, why does it work on my blog.
Okay.
Yeah.
We have the slides, but it's hard to get it up. I know a lot of people just joined, so what Dr. Zhang is talking about is it's not about zapping the virus, it's about being, preventative and keeping our immunity up, especially with listen, I just want to have spaghetti bolognese with like 5 garlics and this sprinkled on top with, this allicin and circulation P, just preventatively is something that we all should be taking. I take it and I feel good. And there's lots of there are 3 other Chinese applications that have been approved by, the FDA of China, basically, and they're all, they're 90% effective or more in treating COVID, and Dr. Zhang has them. So we talked about something else, which is interesting, Dr. Zhang, that if you have very high antibodies, having a vaccine might not be in your best interest, right?
Yeah, I think that because the COVID-19, another kind of very dangerous pathology is so-called cytokine storm, explosive inflammation. This part, the conventional medicine using steroids. And we can using AIM. AIM is the botanical steroids effects without the steroid side effects. We've been using it for treating lupus, rheumatoid arthritis, ulcerative colitis, psoriasis, those are autoimmune conditions. It can also control the cytokine explosion, and the cytokine storm causes severe inflammation in the lung. And then lung becomes fibrosis. Lung loss its function. And when we're treating liver disease, HCV, and the HCV also causes fibrosis and cirrhosis. That is liver fibrosis. And we're using 2 things for anti-fibrosis. This is borrowed from silicon lung. Those miners, they're digging in the mine, they inhale lots of dust. So this dust causes lung fibrosis. So we borrow this treatment. One of the treatment is circulation P.
Oh, wow.
Another is called cordyceps. CORDYCEPS.
A mushroom.
Yeah, so those things, so we are well prepared for these things to come, especially for my older patients. They believe me, they trust me, I have to be well prepared for them.
I think people want to be your new patients. So does the Artemisia come in at all with COVID, or is that just more for cancer? Where does the Artemisia?
Artemisia, the active ingredients is artesunate, ARTESUNATE. Artesunate is the first line anti-malaria recommended by WHO. We borrowed for babesiosis. which is malaria-like protozoa. It's a very common co-infection of Lyme disease. It's also good for ehrlichiosis, which is infecting white cells. And a study done in China, in Germany, found it also antivirus, anti-CMV, herpes, and EBV virus. And the study done in Washington State University in Seattle, they find that because the cancer cell replication has the same mechanism like Babesia protozoa and malaria protozoa. They need ion reduction, oxidation, metabolism. And because this similarity, they borrowed this for treating cancer. They testing the many different cancer lines, find it can suppress the cancer reproduction and promoting cancer cell undergo apoptosis. Apoptosis means to die. And so because this, we've been using it for preventing any pre-cancerous condition, like ulcerative colitis has a polyp, and the pap smear positive for dysplasia, for the stomach intestinal epithelium dysplasia. And those are the precancerous condition. And also for cancer survivors.
Right.
Cancer survivors, after the oncotherapy, the main lesion may be addressed, but they leave so-called minimum residual disease. The minimum residual disease is the foundation of relapse and metastasis. And the relapse and the metastasis, those cancer cells are mutated. They are much more malignant than the original cancer. So this part has to be addressed. To address these minimum residual cells, we cannot using chemo. Chemo is too toxic. So we're using the artesunate. It has no toxicity at all. I have a patient with liver cancer. Her name is Margaret. She living in Maine. She has liver cancer. She has been doing this for preventing relapse metastasis for more than 15 years. And her lesion, and her oncologist follow up, found her lesion became scar. And I told her to stop the treatment. She said, I don't dare. Then I said, let's do this. You take 1 month on, 3 months off, 1 month on, 3 months off. So that is a very benign treatment, very good treatment. We're using it for our self-prevention. You know, according to the autopsy records, everybody around 80, nobody without cancer.
Right.
Even few cancers. I'm 82 now.
By the way, not to go into a different direction, but everyone wants to know what you're doing with your skin. You look so good, but we'll do that after the
The
COVID.
skin is circulation P.
Okay, well, you're going to tell a lot of that now because
Circulation is interior cosmetic, not to put it on the surface. It interiorly improving the blood supply to the skin. So the skin is, I don't have any liver spots.
you take 2 a day.
3 a day.
Well, you told
I
me
have
to
been
take 2
taking
a day. Now I'm going to take
More
3
than
a day.
25 years. I have been taking many, many years.
So you take, and how many Allison do you take a day?
Right now, as a prevention, I take 2 a day.
So why do you take 3 circulation P as an overall circulation?
For my overall the general health.
I know a lot of people have questions, and the only other thing I want to ask is that, are you saying that, are you concerned about high antibodies and a vaccine causing another potential cytokine storm because it's just that little icing on the cake? Like,
You know, the inflammation, if self-limited inflammation is good, our body using inflammation to eradicating invasion of the pathogens. But over explosive, too severe inflammation is bad. So that is why we need to prevent. So we're using the AIM to preventing this to happen.
so the
And
AIM
also-
is like a natural steroid.
Yes, it's very good for that.
So this is just a gentler, more natural way to work with the body in a harmonious, holistic way. And why would we not want to do that? You know, it makes sense.
Yes, that is because, you know, if you look back, last century, clinical therapeutics, there's two great discoveries. One is antibiotics, another is steroids. This is the most important discovery of last century. And we are now treating most of disease using this anti-infection and also anti-inflammation, just these two treatments. So if we have alternative way of doing this, we can cover many different diseases. That is why we develop our own remedies. You know, the herbal remedy are not regulated by FDA. So I don't know what other products, how do they made. But I design my own products and I have our own facility to produce it. So I know what they are, how potent they are. So our slogan is the active ingredients identifiable.
Identify. I like that.
And the potency can be measured. Clinical action can be predicted. Clinical outcome can be repeated. That is our slogan of our products.
Well, Dr. Zhang, you're very humble. You've done, I mean, again, you were at Harvard, you've done tons of medical research, and I know that everything that you do is done with tremendous integrity and accuracy. So I know people have questions, and we could start with Andrea. Can people ask you some questions? Is that okay?
Yeah.
Andrea? Dr. Zhang, are you accepting new patients? Somebody asked.
Yes, we still accept new patients. Yes.
Oh, that's very good. So who would like, I'm sure everybody has questions. Who would like to ask a question? Is everybody muted? Is this my fault here? Can you unmute yourselves?
I would like to know where you get some products. That would be nice to know. It's Kim.
The products we provided from our office,
Mm-hmm.
we have a company called the Zhang Health Company.
Mm-hmm.
And so that is, it's running by my son. He's going to take over my business because I'm 82 years old. I'm early, should have been retired long ago, but I'm still working on here. So, but I still for designing and for monitoring the production, and also we provide it from our office.
So we can come in for a consultation first. Is that the most to come in for that and then go from there? Sounds good?
Yeah, you can go on to the web and Zhang Clinic MY, zhangclinicmy.com. That is our the website, and then you can make appointment there. Also.
Thank you so much.
It's all, you're doing everything by Zoom now, right? Or however, you're not, are you seeing
But
people?
now we are not open yet because the Manhattan office shut down for now. I think it will not reopen until the government announce it. So that we just working on over the phone.
Okay, I have a question from someone who can't put on their phone, but she had an autoimmune reaction to a spider bite and it was doing okay, but she had some dental work and a lot of the cartilage in her body was destroyed, but the dental work caused her shoulders to freeze up.
Yeah.
And I would imagine right off the bat, circulation P would be one thing, but what would you suggest for her because of the unbelievable inflammation and she can't move her?
That you need the AIM. And also the team that discovered the ART-M, the Artemisia, and they win 2015 Nobel Prize. And this team, they are studying to using it for treating systematic lupus and rheumatoid arthritis. The efficacy is more than 90%. So also ART-M can be used for treating autoimmune disease.
So the protocol for that would be the
Either AIM or ART-M plus circulation P.
Okay. Okay. Did you get that? Whoever that was? AIM, wait, not Artemisia, right? AIM and circulation P.
Yeah. But also if we were as an alternative for the AIM, then you can using ART-M also.
What's the difference?
ART-M is we mainly for treating babesia.
Oh, okay, so for the shoulders.
And the cancer, but it also can be used for treating rheumatoid arthritis and lupus. So it also has autoimmune regulatory effects.
And they could call you to discuss a protocol, correct?
Yes.
So I suggest
We have two kinds of consultation. For people, we have a formal consultation. We keep records as our patient. And this we charge $150 for life. Just one time, $150. Then for lifetime, no more consultation fee. Another is complimentary, no consultation fee, but it's mainly 15 minutes of the complimentary consultation. That's
unbelievable.
You can make appointment both for complimentary, no charge, and for 50 minutes. Then as a new patient, you pay for $150 for life.
That makes me want to cry. Just because people don't give like that. That's so beautiful.
I know.
I think because we think this is what we can do for many people with chronic condition. They already being financially suppressed quite.
I have someone asked me if you could ship to Europe. She's a doctor in Europe. Do you ship your products to Europe?
Different country has different custom.
Italy?
Laws. And we ship to German, we ship to UK, we ship to the Switzerland, Italy. I think we ship to Italy also.
So what number do they call for appointments and what number do they call for supplements?
One moment. I'm sorry. Just one moment. I get the number.
No problem. Well, guys, I don't know about you, but to have this level of intelligence and giving mixed together is really humbling.
I agree. It's lovely. I love medicine and he's so generous. Thank you.
Oh my God, unbelievable.
Oh, I love medicine. I love medicine.
Can you repeat, type in the web address, please? Because I didn't get it clearly.
Sure. Actually, because I have all these numbers for him. I'm just going to wait till he brings back and I'll put it in the chat room. And does anyone else have any questions? I'm sure he will ask. It's so cute because this is his first time on Zoom. But the first thing I did say when I saw him is, what did you do to your skin? So
And his hair also.
he's
My
a
God.
walking, but he walks the talk. And so, yeah. Pretty amazing. I was diagnosed with Lyme and a certain doctor wanted to put me on a lot of, oh, I have a question for him. I knew I couldn't do the strong ones because of my prior history, and I went on his protocol, and it was amazing. It was just like boom, and without any side effects. I mean, you might smell a little bit like garlic, but other than that, it's just so easy.
Barbara?
Who's that?
Barbara? It's
Hey, Les.
Leslie.
Hi,
Hey,
Les.
what was the podcast that he discussed in the beginning? I know it was Andrew Weil, but then he
Okay, so
said,
go
It's
to
in
the-
the chat.
It's in the chat room, and actually Jeff Feynman was nice enough to put it up. So let me, can you go into the chat and I'm
yeah,
gonna.
I see, right, I see it. I guess I could just
Now,
copy
if you
that.
guys go to his blog, which I'll also type up, the whole link to all of the articles with Andrew Weil, and I mean, he's quoted all over, sometimes incorrectly, because I had read an article where someone had quoted one of his products and he said, that's the wrong product. So, you know, there you go. You have to just check all your bases because even, you know, people get misquoted.
Right, right.
Barbara,
I think,
there's some place that he has a list of ingredients of his substances.
Yes, and so I have a whole, I could really try to do this, but this is going to scare me, but here it goes. I have okay, I think I'm doing it. Okay, it's Dr.
All right.
Zhang. So-
Good going.
The number to make appointment is 914-259-0346.
Okay, that's for appointments. And how about to order?
The original, in the Manhattan, the original phone number is 212-573-9584, which is new message
Did you
because
say,
the office is closed.
wait, I'm sorry, 212,
573-9584.
okay, I have a couple more questions here.
Yeah.
What is your blog?
My blog is LD and ANDMCM.com.
Oh, wait,
LD stands for Lyme disease
okay, LD
and AND
and
MCM.
that's the blog.com.
Yeah.
Okay, somebody wants to know about the effect of the teeth on the body and dental work on the body, and how I know you said that you always take one Allison before you go to a dental appointment, but is there anything else we need to know about people that have a lot of issues with their teeth?
Because I try to very hard to avoid to using antibiotics. And so whenever doing the dental work, because it's sometimes you will have some bleeding or something, so you have to protect you. And so I just using a small piece of cotton, pull the Allison capsule, the contents into the cotton, make a cotton ball, put it into the dental area, that then this can preventing infection.
Wait, someone, can you mute your phone? If someone's making dinner and we could hear you. So you put a little bit of Allison in a cotton ball? And
Yes,
you keep it in your mouth while the dental work is going on?
yes, let me show you.
Oh my God, Andrea, I should have been doing this like 20 years ago. Guys, someone is, can you guys mute? Who's not muted? Because we hear someone making dinner and
This
it's,
is a small piece of cotton. So you can do like this.
can't figure out who's not muted. Oh, God.
Okay, this is a cotton ball inside the Ellison. Then you put it,
Leslie,
Leslie, you got to mute.
yeah,
Oh, so you put the whole, wait, did you open up the capsule?
yeah, open this, yeah,
Put it in the cotton ball
yes.
and then just keep it in your mouth while you're getting the dental work done.
Yes.
That is amazing. Does anyone else have any questions for Dr. Zhang? Who is that?
It's what-
Can Dr. Zhang talk about what's in the circulation P? What is it? I don't understand what circulation P is.
Who is that?
Donna Senarizio.
Hi, Donna. Okay, so Dr. Zhang talked about circulation P. He'll do it again, but it's to promote circulation into
Yes.
all of your organs. But go ahead, Doctor, and it's great for your skin.
You know, the circulation is the body's transportation. When the transportation is better, every function is better. I give people analogy, like in New York City, if the UN has an assembly, that all the traffic pushed to the west side,
Oh, sorry, who is that?
and the whole city's function goes down.
Can someone help me find out who's not muted? I don't know why I can't figure that out.
It looks like
It's
you're,
Ermi. It's
Barbara.
Ermi Carr.
Barbara,
Yeah,
you can mute everyone because you're the host. You can mute everyone but the people who are supposed to be talking. So you don't have to ask them
I
to
feel so
try to
powerful.
figure
I just don't know how to do that.
I don't think Leslie looks muted, right?
Barbara, go to participants and then look either on the top right or the lower left. I think it's a participants tab, and I think you go to
Got
the
it,
top
got
right
it.
or top left.
Yeah.
I think it's Mimi T, Barbara, that's not muted.
No, because I was saying it's Ermi. Ermi was the one unmuted before everyone started talking.
Okay, so Dr. Zhang, okay, Ermi, please mute.
I'm muted and I'm sitting down. I'm not doing dinner. So I'm speaking to you as I just heard you. It's not.
All right, well, whoever it is, we love you, but please stop. Dr. Zhang, the circulation P, you just said something very important about that. What was that?
Circulation P.
Yeah, the last thing you said, did anyone hear? It was something about, do you put that in your mouth too?
Circulation P is the transportation. The circulation is transportation of the body.
Right,
So when the transportation is better, every body function getting better.
right.
And so not only increase blood supply to the tissue, and also we using it as interior cosmetic effects, make your skin much more smooth. And also people with liver spots, after taking this, the liver spots gradually disappear, fading.
That's amazing, amazing.
Because liver spots is the stagnancy, is the accumulation of the wasted substance. So it can remove it.
Dr. Zhang,
May I ask a question about circulation P really quickly?
sure.
Dr. Zhang, I noticed in the ingredients that it contains dong quai. So would you say, since dong quai is estrogenic, does that mean maybe circulation P may not be good for some people?
Dong quai in the formula is very small amount. And the Chinese medicine's formulation is considered to balance all the herbs effects. So this amount of the dongquai will not cause a problem with the hormonal change. And this much less affects on the hormone. It is much more important for the blood circulation.
Okay, thank you, doctor.
I have another question. So do you feel 100% confident in most cases to use the allicin in place of an antibiotic?
We've been seeing that people with chronic Lyme disease, they've been using the very long-term antibiotics and rotating different antibiotics. And even that will not solve the problem. And instead of using allicin, because it's antibacterial, mycobacteria, fungus, protozoa, and certain virus. It's very wide spectrum. It's a very small molecular weight. Its molecular weight is only 162.27. So it's very penetrating to the blood-brain barrier, penetrating the biofilm, penetrating the cell membrane. It also works for the cyst form. Most of antibiotics are killing bacteria by destroying the cellular wall. Once the bacteria shed off the cellular wall, become a cyst form, then the antibiotics become less effective. And allicin killing bacteria is not based on destroy the cellular wall. Therefore, it works for the cyst form. So allicin is really very good. You know, allicin garlic, it's become very famous. Many garlic products in the health store, most of them advocating odorless, chaotic, aged. They reduce odor. Reduce odor reduces efficacy of anti-infection. We just opposite using pure odor. And the pure odor, because the odor is can be evaporated, you cannot make a product. We using allicin's precursor is called alitridi, A-L-L-I-T-R-I-D-I. Alitridi is chemically stable. We can make products. And one molecule alitridi metabolized in the body turn into one molecule of allicin. So it's equivalent to the allicin. That is why we can make it so strong.
Somebody else asked how much allicin should be used after dental, like for how many days after dental surgery? Oh,
But dental work probably just 3 or 4 days.
Okay, and somebody else asked how many milligrams for the allicin, and again, what you guys have to realize is that this is a proprietary allicin. So somebody saw an allicin on Amazon that had 650 milligrams. So with this is 250 milligrams, but it's a special part of the garlic bulb, and it's time release. So it's, you know, I don't think, Dr. Zhang, that more is always better, right?
You know, this allicin is very loosely defined. Very loosely defined. So it's not the 250 is not the real active ingredients. Real active ingredients is called alitridi, A-L-L-I-D-R-I-T-R-I-D-I. Alitridi, every capsule contains 25 milligrams. And according to the pharmacology, the phytopharmacology, the therapeutic dosage for suppress most of the microbiomes, the dosage is 1 milligrams per kilo body weight. And so we are using 1-3 times a day, would it be 75 milligrams every daily. So it's good for 75 kilo body weight. 75 kilo body weight almost equal to 160 to 170 pounds of the body weight. So that is the average for body weight we use.
Right, so I think that these are all proprietary blends that have been formulated by Dr. Zhang, and there's so much stuff out there, but I would rather have it more scientifically formulated. And there's maybe two more questions, Kim?
Yes, hi. I have a question for you. Have you heard of chilblains?
What?
Chilblains.
Chilblains.
Chilblains. CHILBLAINS. So it affects my toes, and it comes from poor circulation.
I see.
But the strange thing is, the rest of my body is warm. All of my extremities are warm, but not my toes. So I've had very, very bad problems. They're fine now, but March through May was horrible. So I'm assuming that Circulation P would be very helpful.
There's a possibility that is not like a Raynaud's phenomenon. Yeah, different from Raynaud's.
A little different.
Yeah. So we've been treating Raynaud's by using Circulation P and AIM. Okay. Because this could be a peripheral blood vessel inflammation.
Yes.
That's caused by vasculitis.
Yes.
Yeah, so that vasculitis is mainly caused by autoimmunity. So
say that last again?
The vasculitis is mainly caused by autoimmune caused problem.
Oh,
so we're using AIM plus Circulation P.
Okay.
AIM plus.
Okay,
and
thank you.
AIM. So what Dr. Zhang generously offered, which is still unbelievable, are these consults, short consults, or to make an appointment, which is still in our world. We all know this, so incredible and reasonable. And I am just so grateful to have you here with us and to spend this time with you. And thank you for everything that you've contributed to helping people in a gentle, holistic way.
Thank you for giving me this opportunity to meet many people and to explaining our approach. I think that combining the East and the West culture together, and we can make things better, I think.
I think so too. And can we do this again soon?
Yeah. Okay, thank you.
Thank you. Thank you so much. We loved it. Thank you so much, sir.
Dr. Zhang, thank you.
Thank you.
Thank you.
Barb, will you send us the recording, please?
Guys, the recording will be on my website. So if you could just go there and get it, it would just be, that's why I'm doing it. It'll be up in, I'll send it to you too, Dr. Zhang. It'll be up in a day.
But where do you put it on the website?
It's under events and it says recordings right there. But I'll talk to you later, Tara. I'll
thank you, Barbara, so much. And thank you, Dr. Zhang.
Thank
you, Dr. Zhang.
Thank you.
Guys, thank you.
Bye-bye.
Thank you very much.
Thank you.
Bye, everyone.
Bye.